Hello, I am Dr. Jaiswal. I am the Chief Neurologist at KIMS Hospital, Kondapur. Today we'll discuss an interesting issue, a common issue which everyone faces, and that is called Bell's palsy and facial twitches or hemifacial spasms. First of all, whenever a patient has a abnormal facial movement, everybody fears whether it could be a stroke. Now, if you look at the stroke symptoms, the symptoms of paralysis which arise from the brain, facial asymmetry, that is, facial deviation to one side, is one of the things which one has to look for. Associated with this, you can have speech problem, you could have weakness of a hand or a leg, or you could have difficulty in walking. So you have to assess these symptoms rapidly. That is why you use the eponym FAST. You look at facial asymmetry, you look at speech difficulty, you look at walking difficulty, and then you try to assess whether this could be a stroke, because stroke is a dangerous situation for the patient, because it's going to make him handicapped for life. So we have to identify this and then treat it. Now, let us leave this paralysis aspect. Now, we are talking today about Bell's palsy or facial nerve palsy. Till such time, we spoke about a weakness which was arising from the brain. But when you talk about Bell's palsy or you talk about hemifacial spasms, what is hemifacial spasm and what is Bell's palsy? Now, when you say Bell's palsy, we are referring to a condition where the seventh nerve is paralyzed. So all the muscles which are innervated by this nerve, they get weak. So the common symptoms are difficulty in closing the eye and deviation of the mouth and unable to blow your cheek and unable to drink water. And when you're drinking water, because you're not able to purse your lip, the water will be drooling from one side of the mouth and you will not be able to blow air properly, and the air will be leaking from one side of the mouth. Now, these are all the symptoms to one side of the face involving all the muscles which are supplied by the facial nerve. And along with this, when you have this facial nerve involvement, because it is closely related to the eighth nerve also, and it has other components or other nerves which are running along with it, you can have a taste disturbance on half of the tongue, or you can have a situation where you hear loud noise in one ear. It's called hyperacusis. Then commonly the facial nerve paralysis is associated with the severe pain behind the ear. Now, why is it so? Because the facial nerve comes out from the brain stem and it comes out of the cranium, that is the vault or the brain or the skull, through a narrow canal. So, whenever this nerve is infected, the causes may be many. It can be idiopathic, there is no known cause, to a viral infection, to a autoimmune situation. There is a swelling of the nerve which causes severe pain as a first presentation, and the pain is classically behind the ear. And after that, you notice that the patient develops difficulty in closing the eyes. So the eyes are not closing properly. So there is watering from the eyes. It's called tearing. And then the patient will have deviation of the mouth to one side. So because if it is paralyzed on the right side, the normal side, that is the left side, will pull the mouth to the left. And when we see, we feel that the problem is on the left side, but actually it is on the right side because it is paralyzed. Then they will have difficulty in swallowing and then blowing air, or the food may stick in the cheek. They may not be able to eat properly. So these are all the symptoms of facial nerve paralysis. And the commonest cause, what we term commonest condition, is the Bell's palsy, which the exact cause may really not be known, but then the treatment protocol for this is we generally use medicines or steroids to reduce the swelling of the nerve as much as possible, because pain is a very classical symptom which tells us that this is a facial nerve paralysis as the highest possibility. And after that, the other causes need to be looked for in certain situations if you have something more than facial nerve paralysis. So, when you say paralysis, that nerve is affected and all the muscles which are supplied by this nerve are not functioning properly. But coming to the situation called hemifacial spasms. Now, this is exactly opposite of the Bell's palsy. It is exactly opposite of the facial nerve paralysis, where because this seventh nerve is hyperactive, it is doing more than normal. So what they will have twitching on one side of the face. They may have blinking, winking of the eye on one side, and then twitching of the face, especially the cheek on one side. And this abnormal movements are more when the patient is tensed up, is anxious or stressed. And then commonly the cause for this would be a abnormal blood vessel which is going across the nerve, the facial nerve, and touching the nerve and causing this irritation of the nerve. So it is exactly opposite. Bell's palsy is a negative phenomenon. The hemifacial spasm is a positive phenomenon, exactly opposite of what's happening in Bell's palsy. Now, with appropriate investigation, you can use certain medicines to reduce the irritation of the nerve, or you can do for imaging. You can look at the nerve properly, look if there is any abnormal blood vessel crossing the nerve, or is there any tumor which is pressing the nerve which is causing this problem. And in this situation you can have associated symptoms like giddiness associated, hearing loss associated, or other symptoms of a tumor in the CP angle. So these are few things which one keeps in mind when one is evaluating a patient with hemifacial spasm. And then the other common condition which we discussed already is the facial nerve palsy, the common one being the Bell's palsy, for which a real reason is not known. But then the prognosis in these patients with Bell's palsy is by and large good. It may take 1 to 3 weeks for these things to settle down, and we have to use the medicines as prescribed. Apart from that, you have to protect the eye till the eye closure becomes normal. So you put the refresh eye drops frequently, you protect the eye, you cover the eye when you are sleeping. When you are going out on a vehicle or you are going out in the daytime, you wear the proper goggles so that the dust and the wind does not irritate the eye. And otherwise you can develop redness in the eye and itching in the eye and infection in the eye. And sometimes, extremes, when the eye closure is defective, people develop ulcers over the cornea and they may lose the sight. So precaution, this has to be explained to the patient, and the patient himself have to take proper precaution to protect the eye till the eye closure is perfect. And then added to this, physiotherapy which they can get properly, like stimulation of the nerve and things like that, and also doing exercises like blowing balloons or taking this bubble gum or chiclets. So these are the measures which help these patients to improve faster. Thank you.